It is 5 o'clock, and I will begin the Health and Human Services Board meeting for May 19th. And roll call, please. Colleen.
Kathy Leaf.
Present.
Kara Koch.
Present.
Dave Osmus.
Present.
Scotty Ard.
Present.
Greg Telejohn. Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward.
She is excused.
Paul McGinnis.
Present.
Okay, we have a quorum. If we take a look at the approval of our minutes from April 21st, are there any additions or corrections? Seeing here none, those will stand as written, and we'll move right on to public comment. Is there anyone wishing to make a public comment at this point in time? And we've got a card from Carol.
This one? Oh, okay. All right. Thanks. My name's Carol Ivance. I live in Hudson. I'm a retired RN, so I know a little bit about healthcare. There's several questions that I have that many others are also wondering about, and I'm sorry to say we still don't really feel heard or that our questions get answered. The first one is, how many times are you currently running the PCR tests, and has that changed? And if so, how many times has it changed, and to what levels, and why? According to the inventor of the PCR test, it's not at all accurate for this test and wasn't designed for this test. And the more times you run it, the better chances it will give you of a positive result, which is a little fishy. It doesn't really inspire trust in our public officials or our sick care system. And yes, I refuse to call it a health care system. I saw it from the inside for over 3 decades. And by now, the only care is for the bottom line for most people, unfortunately. And then we're also wondering, it seems like Kelly, and I don't know if it's Elle or Ellie, I don't want to mispronounce her name, but do they look at the weekly VAERS reports? And if so, why do you keep pushing this fake vaccine? And I'm calling it a fake vaccine because by definition, it is not a vaccine, and it's experimental gene therapy. And it's only has emergency authorized use, which according to RFK Jr., no court has ever upheld a mandate for an emergency use authorization. And then we're also wondering who's responsible for injuries to people, especially teenagers that get this. According to VAERS, I think like last week, because it's updated every week, there are already over 4,000 deaths in the past 4 months from this shot, whatever you want to call it, which is roughly the same number, from the past 20 years for all vaccines combined. That always confuses me, including 3 teenagers here in Wisconsin. Am I over, or is it counting down?
No, thank you.
Oh, okay. So evidence-based practice calls for the integration of the best research evidence, and it doesn't seem
Your
to
time
me-
is up, young lady.
Sorry. I was confused by the clock.
Anyone else wishing to make a comment? Last time, anyone else wishing to make a comment? Seeing none, we will move into our business items. And we'll start off with a COVID update. Ellie. And before you get going, young lady, I am happy to announce to the board that we officially have you on as a full-time employee, and congratulations and welcome to the family officially. You may continue, young lady.
Thank you very much. I am honored and pleased to be a full-time part of Health and Human Services and the Public Health Department. Let me go ahead and share my screen and we will get started.
So Ellie, that means you know that we can really scream and holler at you officially now, don't you?
Yeah, it's official. All right. So again, thank you for having us here for an update from Public Health. I'm going to give a brief update on the status of COVID-19 in St. Croix County, and then we'll pass it to Kelly. So what have we seen in 2021 in terms of cases of COVID-19? As you can see, the graph in front of you starts on the 1st of January. What I really want you to pay attention to is the dark line. The dark line is a 7-day average of the daily new cases. So how many new cases we're getting to the county every day. We can see we dropped down at the end of February, and then we did have a rise in cases into April, throughout April. And then we have, since the end of April, made a slow decline back to a lower number of new cases into the county. We're currently seeing, on average, 13 new COVID cases in the county every day. What does that mean in terms of our risk level for the transmission of COVID in St. Croix County? What we look at is our case activity. Case activity meaning how many cases. We can see that back on 4/21, St. Croix County was the color was dark, which translates to very high case activity, like we talked about. That carried through to the beginning of May. We were still at a very high risk level. We are now, as of today, classified at a high level of risk, meaning there is still medium and low below us, but we have started a descent in terms of the number of cases coming into the county on a daily basis. So of those cases coming into the county on a daily basis, in what age groups are they? Well, what you can see in front of you is January is blue. So January, on the first slide there, we did see quite a number of cases, and they were spread across kind of our middle age ranges. And then February, we did have a decline in all cases. March in gray, we did have an increase, but what we can see is that the increase was the most pronounced kind of in those age groups that didn't have access to the vaccine. So we can see cases really dropping off in the older age groups as we move into April. Now in April is where we started to notice a pattern of the highest case numbers happening in our adolescent age groups. You can see by the yellow bar that the highest number of cases in April was in the 10 to 19 age range. And that unfortunate trend, due to vaccination rates not being as high in that population, in May, we are now seeing that same trend, where the most cases coming in so far in the month of May, 59 cases, is the highest of any age group throughout the population. And so what is important to note is that as we are able to get vaccination into individuals, we are seeing that as a direct translation in terms of case numbers by age group. So now in terms of vaccines for St. Croix County, we are moving forward small amounts daily. So what you can see in front of you for completed series, meaning they have had 2 doses of a 2-dose series or 1 dose of a 1-dose vaccine, 37% of St. Croix County residents are vaccinated. This number is based on the total population. So do recognize that individuals under the age of 12 are not eligible to receive the vaccine. What we can see in terms of first dose completed and completed series over there on the right-hand side, by age, we are starting to vaccinate those adolescents, that highest risk group in terms of number of cases we're seeing. It is obviously lower than our older age groups, which are 65 plus. In terms of completed series, we have 80 almost 83% of our 65 plus population vaccinated, which is a really great achievement. And should note that these are all percentages within that age group. So we do see 14.7% of 16 to 17-year-olds have completed their vaccination series for COVID-19. This is good news as we have more data is coming out regarding the vaccinations. We are seeing not only has Pfizer been able to apply for the complete vaccination license instead of relying on an EUA, but more data is coming out about the efficacy and the safety regarding these vaccinations on a population scale as they've been introduced into the population and are no longer lab-based. So with that, I will hand it over to Kelly.
Hi, everyone. Thank you for having us tonight. Trying to get through a quick update. Lots of changes through this 15 months of the response. We are used to change and almost embrace it on a weekly scale. So last Thursday, the CDC did come out and release new guidance related to people who are fully vaccinated. And remember, fully vaccinated means 2 weeks post the last dose of your series. So if you have a Moderna brand of vaccine or a Pfizer vaccine, it is 2 weeks post the second dose of those. If you received a Johnson & Johnson vaccine, it's 2 weeks post that one dose series. So that is what fully vaccinated individual means. There's really no such definition for partially vaccinated people. People ask me that, well, what about partially vaccinated? No, not gray area. Either you're fully vaccinated or you're not. So the CDC came out and said fully vaccinated people can resume activities as they did before, pre-pandemic without wearing masks. So that was a little bit of a surprise to our public health community. We didn't get any this one caught us a little bit off guard. We weren't hearing indications that this was coming down from CDC. So we have decided today to roll out what that means for us in St. Croix County through this forum with a message to you verbally today, and then everything will be updated in our advisory tomorrow at some point. I know poor Adam gets a lot of questions about, I thought this would be updated immediately after the board meeting. Please look for this on our website tomorrow at some point. So yes, large or small gatherings, people who are fully vaccinated can take the recommendation is no longer needing to wear a mask. However, I think the CDC points out that there are exceptions where masks still need to be worn. We have a list of those here. Businesses, this one's important because businesses people sometimes don't understand that a private business is not a public space. That is a space that is owned, even if it's open to the public, that is still a space that's either occupied by a private business. So if they're asking you to continue to mask, please do so. All healthcare settings will remain in masks. It is the recommendation that all K through 12 schools remain masked. Pupils and employees, teachers, etc. Anything related to tribal lands or anywhere where there are rules and regulations to keep a mask on. Correctional detention facilities, jails, and homeless shelters also should remain masked. Travelers on all planes, buses, taxi services, public transportation should remain in masks. As I said, we will update this tomorrow. So there is guidance out there that can be drawn from our website. Unvaccinated individuals versus fully vaccinated individuals. If if someone hasn't received their vaccine, they should continue to wear masks in public when they are not at home in their settings. Important to practice all the non-pharmaceutical interventions that we've been talking about through this entire response. We call them NPIs. So keeping your distance, staying home when you're sick, washing your hands, avoiding crowds and large spaces. Those are all things that we encourage unvaccinated people to do.
Any questions or comments for Kelly? Kelly, do we have an update on our local website of the additional places that you can get a vaccination? Has that been updated at all?
I don't know if Adam's on. Adam's in charge of updating the website. I know we still are in frequent communication. Just this week, we went down to once a week meetings with our healthcare and clinic providers versus the 2 that we have been meeting with them since November. We are always in communication related to vaccines. I don't know if it's on the website. Dave, I don't have time to go on the website to see what's out there, to be honest.
Chair Osnes, I can speak to that.
Okay, thank you.
Yep. So on the vaccine page of our website, we do have a link to the WCVR form. That's the form for the state. So if somebody goes on there and fills out that form, they can get paired up with a location that will work for them. We also have a link to vaccinefinder.org, which is another website where people can go and find a vaccine that is within a location that's convenient for them. And aside from that, we do have contact information for all local healthcare providers as well.
Okay, thank you. Any other comments? Kelly and Ellie, thank you again. You guys are doing a great job. And Kelly, you've had some awful long days here, and we appreciate that extra time that you are putting in. It's rather difficult, and I understand that. But keep up the faith. We're all praying for all you guys, and you're doing a super job. Thank you. And with that, we'll move on to our monthly financials. Faye.
Yep, I am here. I will share my screen. Where did this go? Okay, can you see the financials? No, yep, okay. So I have the financials. These are through April of 2021. Just comparing April of this year to April of last year. Our revenues are a little bit ahead of where they were last year. Part of that is the property taxes. Property taxes are allocated 1/12 every single month. But the other area where you can see this is in our mental health and substance use revenues. During March and April of last year, we were under the stay-at-home order, so there was a kind of a pause in those local revenues. This year, those continued uninterrupted, so that's part of where we're ahead a little bit on those. This is our actual 2020, and just to point out that that number continues to change. Last month we were at 444,000. This month we're at 593,000. I just posted another 110,000 to December of 2020, and we're still expecting our final children's long-term support and children's COP revenue. We are currently working on that with our auditors right now, reviewing our 2020 information. So that should be finalized here within the next few weeks. And then Clifton Larson Allen does a report back to the board with the final audited numbers when that's complete. So I didn't really have anything specific per departments to highlight for you. One of the areas that I will watch is our behavioral health purchase services. We have had several placements, long-term placements in Winnebago and Trempealeau. So those, depending on how long they last, will affect our purchase services. But we'll see those more next month. Hopefully, those placements will end shortly. For our health center campus, this report was ran as of May 11th. The revenues for April for our health center campus did not post until May 13th, so they are not included in this year-to-date number. That number was about $418,759. So there is revenue for April that's not yet included in here, although all the expenses are included in here. Even with that revenue, we will still be showing a loss for the health center campus. They are continuing to admit, we were just looking at the numbers, and they've had an average of 12 admissions each month this year. So, I mean, they're seeing those admissions and discharges. They tend to be very short term at this point. But that is, continuing to change. And Sandy is working hard. As I mentioned last month, they do have a lot of extra expenses in their non-billable nursing supplies that we will be able to capture through the ARPA funds that are available. Veterans Services is doing well. They did get part of their grant money in. They are expecting another $2,000 in grant funds available. And otherwise, they just kind of, have their relief they support or provide to indigent veterans. And here's the purchase services. You can see behavioral health is the blue line. So that's the one that's continued to grow, so we'll keep an eye on that. Children's Services has actually had a steady decline since the first of the year. They had some very expensive placements that ended. So that's all I have. Do you have any questions for me?
Questions or comments? Not seeing any. Faye, thank you for your time, and you're doing a great job, young lady. Keep up our good work.
Thank you.
And with that, we're going to move into our final agenda item, which is our Health and Human Services annual report that we do every year. So I'm going to turn it over to Bob.
Thank you, Mr. Chair. Good evening, Board. And thank you to all the division administrators who are joining me tonight to help me present this report. As you can see, it's 44 pages long. Before I get started on it, on reviewing it, I would like to first thank all of our division administrators and their staff for putting together this material, and Colleen Linder for taking all of that and putting it somehow into a coherent and formatted package that you have in front of you. So a lot of effort went into this, and I just wanted to thank those people that were responsible for making this report final. So I come to you almost a year. I've been here almost a year now, so I came to St. Croix County about 6 months into the pandemic in June of last year. Prior to that, I was at Hennepin County responding to the pandemic probably in similar ways as you were here. So in the month of June, I came to St. Croix County, and I came to an empty building for the most part at the services center, and began this adventure. But the year 2020 was unlike anything I've experienced in my career, and probably the same for all of you. It doesn't compare to anything. I don't have a frame of reference for what it was like, but the amount of flexibility, the amount of adaptation that had to occur on behalf of human service departments was astounding. In Hennepin County, when I was there, we went from in-person services, everybody in the office, to everything remote overnight. And I understand it was that way here as well. So there was a transformation that had to happen in the way we provided care to the public and services to the public that had to happen right away when this pandemic began to really impact our communities. And the public needs didn't go away. There was still all of those public needs that had to be met in a different way. In the middle of all of that, you had a new HHS director start, you had your behavioral health administrator retire, and you had new leadership at HHS. So throw that into the mix, and there we go. So we had an interesting year, and I don't think the data and the tables and the brief summaries quite capture it all, but I'm going to go through this report section at a time. I have invited the division administrators to join me tonight so they can answer specific questions. Our programs and service areas are very complex. There's lots of moving parts to them, and I'm not going to be able to answer in detail if you have specific questions for some of these program areas. So thank you to the division administrators. As I go through this report for each section, I'll introduce them, and at the end of each of the sections, I'll pause and allow for questions for each division administrator if you have them. I'm going to go by the page numbers on the annual report itself, so I think those are listed on your agenda in the middle of the page there, so that's what I'll be referring to as I go through it. But the first page, it's page 2 actually, of the report lists all of the Health and Human Services board members and the Council on Aging board members. As we go through, we have the mission and vision statement and a listing of all the divisions that we operate in Health and Human Services. There's FTEs attached to those divisions, so you can see how many full-time equivalents work in each of those divisions. And then on page 4 and 5, you have financial summaries for HHS revenue and expenses for the year in comparison to year 2019 and in comparison to the 2021 budget. And on page 5, you have the same thing for the healthcare campus. There's an asterisk there that shows that the actual expenses for 2019 include depreciation in that amount. Are there any questions about the financial summaries that are listed or that are posted here? As you can imagine, COVID has impacted our department in every way imaginable, but to different degrees in different divisions. So as we go through this, you'll see the comments related to the impact of COVID on some of the data and some of the service delivery models. So we'll try and point that out as I go here. The first division is the records division that Tammy Wilson supervises. And the records division, of course, is responsible for all of our records and for ensuring that we comply with protected health information regulations like HIPAA, the Health Information Portability and Accountability Act, and 42 CFR, which is a federal regulation that governs addiction treatment for privacy. And actually 42 CFR Part 2 is more restrictive than HIPAA. There's a lot of nuance to that law that requires Tammy and her team to pay special attention to addiction treatment records so that we're not releasing information when we shouldn't be. You can see in the release of information numbers that number is significantly lower for 2020 as compared to 2019. The request for information, the demand for requests for information went down primarily due to providers not offering services or limiting their capacity due to COVID-19. Tammy is here if anyone has any questions about what the records division does or how they do it, or any other impacts that maybe COVID-19 had on that division. Or Tammy, you're welcome to make comments as well, if you have any.
I don't have any comments, Bob. I can tell you as of today, we have released and worked with other agencies. Our numbers are about 225 releases to date. So that is on the projection to be much higher this year, which is expected as we get more into services and people are more coming into the building.
Thanks, Tammy. Is there any other questions that anyone has for records? Okay. Moving on to office support staff, Colleen Linder is the executive administrative assistant that oversees office support staff who have been, with very few exceptions, have been present in the building throughout the pandemic, greeting the public, being the public-facing employees of our department, even when most of our services were remote. And now that we're beginning to increase our in-person service delivery, of course they have a more, I don't want to say lively job experience than they did during the pandemic. But Colleen and the support staff have really done a nice job in supporting other divisions and doing their work differently, helping to support them with remote work kinds of needs, mailings, and gathering of information, and just coordinating some of the efforts that other divisions were making in response to the pandemic. And of course, all of the other tasks that go along with providing services directly to the public and being sort of have comprehensive knowledge of all the different divisions and all the different needs of the public, so they can help people as they come in. I think the reception activity reflects down below on that chart on page 7 of the annual report. The number of calls and the number of walk-ins significantly decreased during 2020, again, as a result of most of our services being remote or telehealth in nature. So you can see that reflected in the graph by monthly total there. Just by comparison, the number of walk-ins was about half of what they normally were, or what they were in 2019. And Colleen, did you have anything to add to that? The outgoing mail, I guess, is about the same, reflected on that graph on page 8. But did you have anything else to add to this?
I don't, other than, I would mention the outgoing mail. That was one of the significant ways we changed our service delivery for many people, because we still had to have forms signed and that type of thing. So there was a lot of using of our business reply mail, sending to the consumer, asking for a return signature, and it coming back. So there was a real shift to that, which we worked hard to handle as quickly as we could, and came up with clever ways to receive it. As also, we did let people drop off mail. We have an outside drop box. And responding to the need, we let people put it in there. That's checked several times a day. That was one of our significant changes in the process of assisting the consumers.
Thank you. Any questions for Colleen? Yes?
This question isn't necessarily just for Colleen, but I'm wondering, you talked about some of the ways that staff had to adapt to deal with the COVID situation. And I'm wondering, for not only this department or division, but the rest of the HHS area, are there changes that you found when you adapted that you think, okay, going forward, this is going to provide more efficiencies for us, and now we're going to stick with these changes? I'm just wondering if that's something that was discovered as part of the process.
Yes, thank you. There's several things that I think will continue as a result of the pandemic. One that I'll get to is our Economic Support Division is going to remain working remotely as opposed to coming into the office. That frees up some space in that hallway at the services center that we're going to use for our financial team to move into. So the economic support team will continue to work remotely. They can do their work remotely, and there's no need to bring them back to the building. So that does free up some space. The other thing that jumps to mind is the use of telehealth and how that can be effective, specifically with populations that may be due to distance or geography, they can't make it to an office visit, or they can't come to a location to meet in person. So telehealth would be a natural option for those folks, and for anyone else who may be where an office visit might not be a necessary way to provide an intervention. And I think telehealth offers a lot of, over this past year in 2020, we've seen that telehealth offers a valid way to interact with people that doesn't require in-person settings. And I think we're going to study that a little bit from our end to see how that data from more statewide, more national, shows that telehealth has certain advantages over in-person service delivery in certain situations. And we're going to continue to have that hybrid model in place so that we utilize telehealth whenever we can. There's options for that, not to go on and on, but there's options for that as well for emergency services, where I think technology and telehealth could be utilized differently to reach people in their homes and in certain situations of crisis. So those two things come to mind for me. Yeah. Anyone else? I'm going to move on to the ADRC. Brad is here in person, live, to answer questions if you have any. Brad has done a nice job here of laying out the various programs that the ADRC offers on page 8 and 9 there. He can answer questions, I think, specific to any of those programs in terms of what the services that are offered consist of beyond what's summarized here. If you look at page 10, and some of the data there, the thing that stands out, I guess it's page 11, the thing that stands out primarily is the number of, is that the right page? No, I'm sorry, it's the following page. Page 12, the number of meals that were in home delivered versus congregate. Obviously, we didn't have congregate settings open, so most of the meals were delivered. You can see the difference there in terms of the 2019-2020 comparison. Dropped off really in around March, I think, probably, where the congregate meals were no longer offered. But the number of home delivered meals increased. There's a note at the bottom of that page that explains that grab-and-go meals were also considered home-delivered meals. The other thing of note on just the point that I was going to make was the number of memory screens related to the dementia care program. You can see was 0 in 2020. Again, that was COVID-related in terms of not being able to meet with people in person. And we had a new dementia care specialist hired in 2020 that needed training. So Brad, I don't know if you want to add to that. That was a pretty quick overview, but.
No, I think it looks real good. If you noticed, in many of our programs, our numbers were actually up because people needed the services were there, and we kept functioning and running as COVID hit. And the home delivered concept, congregate meals sites closed, and we're looking at reopening and working with the team to get that planned. But if you look at the home delivered meals, that has almost doubled in how many we used to serve. So, and I think that's one of the points. I think you're going to see more home delivered meals as, and looking at kind of reorganizing, planning, what can we do to make more things efficient. So, and the other thing I can see is when we do staff travel. I used to travel down to Madison and that, had state meetings on a monthly basis. Now we Zoom everything in. It's much more cost-effective, better time-consuming. I think that's going to be the way of the future, too, so. But is there any questions on the ADRC?
Well, Brad, and with the home-delivered meals, one thing too, I think that you and I and the council talked about was how grateful we were for all the extra drivers that stepped up.
Right.
To make that happen. Our hats are off to those great guys and gals.
Yeah, they worked from day one when COVID never stopped it. So we're still serving meals on a regular basis, and that's why it's increasing. And the whole checking in on people and the safety and following the guidelines, and so that, yeah, it shows, so.
And the ADRC continued to provide medical transportation.
Correct.
Rides for people that needed that. We stopped providing rides for anything but medical needs.
Yeah, and now, actually, as of Monday, we've opened it up to shopping and other opportunities for people. Obviously, we have to follow the guidelines, but two can be in a bus and one in a van, and we've opened that up, so you're going to start to see that number increase, too.
Thank you. Any questions for Brad while we have him here? All right. Moving on to the Behavioral Health Division. Also, in June, when I started here, the Behavioral Health Division administrator retired, so we had a situation where we had Kathy Houston and Kristen Depre serving as co-interim administrators for the Behavioral Health Division from I think June through November. And they really, I have to give them credit for stepping up and really, in addition to their normal duties, stepping into that administrative role and helping us figure out what to do with behavioral health services in light of the COVID-19 restrictions that were preventing in-person services and a lot of the programs in our community limiting their capacity to take people. So they served with distinction until November 1st, in which time we hired our full-time or permanent Behavioral Health Division Administrator, Char Lopez, who's with us tonight. And Char began in November 1st of 2020 in that position. The real challenge in behavioral health was making that transition from in-person to remote work. It required a lot of regulatory changes in the way of getting variances from the state for telehealth options, to provide groups through telehealth, to ensure that health plans would pay for specific types of telehealth, whether it was telephone or they required video, and then how to train the staff and prepare them for doing these kinds of sessions remotely instead of in person. It was a huge transition. I think the staff did a wonderful job of making that transition and being flexible and working very hard to find those, to ensure, I should say, that those regulatory requirements were being met by our division. So I think the end result was we continue to provide mental health and addiction and crisis services to the public in different ways. And I think effectively, and it was due to the staff and the administration of that division, the success was due to them. So I give them credit for that. The summaries on page 13 and 14 outline the specific program areas and service areas that the Behavioral Health Division operates, including emergency services. The chart on page 15 looks at emergency detention diversion by community program. It's remained fairly static during the pandemic. We, on page 16, we mentioned there at the top that in addition to our mobile response team at St. Croix County, we also contract with Northwest Connections to provide additional 24/7 coverage for emergency behavioral health situations in the communities, and we also partner with Hudson Hospital in their telehealth program, where they offer licensed social workers, not 24/7, but noon to midnight daily, televideo staff that are social workers to triage mental health and addiction crises in the community, and are also available as another resource to our crisis response. We have seen anecdotally anyway some increase, not so much in the number of crises in the way of mental health and addiction, but the complexity of the cases seems to be increasing in that the severity or the multiple layers of crises that people are presenting with tend to seem like anyway they are increasing. An example of that would be some of the economic stressors and some of the family stressors, social stressors that have resulted from the pandemic and people being confined to their home or stressed from economic reasons or other reasons. We're probably going to see the true impact of some of these mental health and addiction related issues unfold as years go on. Actually, I think we're just beginning to see some of the results of a year-long traumatic event, essentially. Shard, there's only one other thing I was going to mention real quick, and that has to do with the Intoxicated Driver Program wait list. I know there was some discussion about that when I started here in June of last year. The wait list was excessive, but the Behavioral Health Division has made efforts to reduce that wait time. It still fluctuates a bit depending on demand, but for the most part, those wait times are greatly reduced.
Yeah.
And we're in 2020. Adult protection interventions were relatively stable, as were community support services caseloads. But feel free, Shar, to jump in and elaborate on anything that I didn't.
Sure. I just wanted to reiterate the complexity, and it isn't just in mental health, but it's adult protection, and we are getting maybe younger kids with in crises, and then the following piece to that is our lack of crisis beds or the shortage of crisis beds, and we have individuals who are ending up in our IMD up in Winnebago, which is a long ways away, maybe not necessary, but sometimes the only thing that's available to the crisis worker and law enforcement at that time. So that continues to be a concern for everyone. And with COVID, we've really had to think differently, and a lot of, like what was just brought up, a lot of people have had to be a little bit more flexible in the way they work with people, whether it's telehealth but really meeting people where they're at with how we can do it, which has really lended to some out-of-the-box thinking in trying to move forward. So in behavioral health, we have really taken this opportunity to do a continuous improvement project and really kind of look at our baseline and our services and how we connect to all the other divisions within HHS, within the county, within the community, and really trying to be as creative as possible to work smarter, not harder, wanting to really collaborate with our community providers.
Thank you. Any other questions or comments for Shar? All right, thank you. I'll move on to Children's Services. I'd like to welcome and introduce Michelle Lesha, who is our brand new interim Children's Services Administrator. Julie Krings didn't retire, she resigned as of yesterday. So Michelle has accepted the position of interim Children's Services Administrator, and thank you for coming tonight, Michelle. Children's Services has continued to provide services to children and families throughout 2020. in person. It was an especially challenging time, and Michelle, I'll let you elaborate, but it was an especially challenging time because placements for children who were in need of out-of-home placement were difficult to find. Many of the providers had limited capacity or had refused to accept new admissions or placement. So there was that added burden of not just having an increasing number of out-of-home placements to find placement for, but having a provider network that was reduced in capacity to accept them. Children's Services did a wonderful job of managing that crisis, that situation, and always finding solutions when there didn't appear to be any on the surface. The other, I think, thing of note for 2020, it's not unique to St. Croix County, but one of the primary drivers of child out-of-home placements is parental substance use. And we've seen, in 2020, we've seen an increase certainly in methamphetamine-related out-of-home placements or reasons for child protection to become involved. And alcohol remains also one of the primary drivers. But those factors are something that we've certainly recognized as in need of attention and in need of interventions that are designed to address parental substance use in a way that treats the entire family and not just the individual parent that might be affected, but ways in which we can prevent the family from being divided up and keep them whole and work with them more holistically. The data that you see on pages 20, well, there's a long list of programs and services that Children's Services administrates, so you can look at those, and if you have specific questions, Michelle would be the best person to ask about them. And I think, Michelle, I would just open it up to you for any further comments on any of the information that you provided here in this report.
Well, thanks, Bob. Well, I thank Julie Krings for gathering the information prior to her departure, but I did get a chance to review it and just want to highlight on a couple of areas in which you mentioned. One, in regards to our placement and our providers. Our staff work really hard at trying to find relative providers, and that is something that we pride on here in St. Croix County, is being able to find relatives that will take children who are in need of placement. And our providers themselves, we did have a few that were willing to open up their home for potential COVID positive cases if they were coming in. So it was a big struggle for us at the beginning, and so we're thankful for all of the providers and the staff that work hard to, especially to get placement for the kiddos. The other thing I'd want to mention and just touch on, I just reported to a committee, a CASA committee, in regards to the amount of substance use. 64% of our ongoing child protection cases right now are substance use related. And when you start looking at those numbers, it does put things into perspective on where our need is, and we're working closely with behavioral health and trying to come up with some programming. The last thing that I'll mention is just in regards to COVID and how our practice has changed. Through this past year, the state has authorized our social workers to use virtual visits in the home if there was a concern for an illness, COVID, any type of illness. So we were able to do that. I don't know how long that will last. Workers are still authorized to do that right now, but first and foremost, if they can, they do go into the home to view safety for children. But they do have that option. And I'll reiterate what Brad Beckman said in regards to those state meetings that are held in Madison. Very thankful that we have Zoom options now, because that is a long trip for sometimes just a 3-hour meeting.
The other thing that I didn't mention, Michelle, was foster care placement and some of the impact that COVID had on foster care parents. Well, you can explain that a little more, but in 2020, there was difficulty, I think, in finding a sufficient number of foster parents to meet the need of kids.
Right, that's correct, and some might be due to, you know, not having the vaccination. Some of our providers really wanted to have that vaccination prior to having kids come into their home. Other reasons that they have their own families that they're caring for, and to put their families at risk too. So there were multiple reasons, and you know, we did have a couple instances where we had a kiddo placed in a foster home that had COVID and we didn't know, and that became, you know, obviously the quarantine and the hardship on the foster family, and just trying to manage that within our own system. And so again, with support of public health and help guiding us through all of that and help educating our providers, very, very thankful that we were able to collaborate on a lot of those cases.
Thank you. Are there any questions for Michelle?
Chair Osnes, I do have a question.
Go ahead, Dr. McGinnis.
Yeah, thank you. Bob and Michelle, when I'm looking at the report on page 22 at the bottom, which is packet page 59, I noticed that the yearly comparison of Child Protective Service reports, overall number of reports, total reports, seems to be relatively stable over the last 5 years. However, the number of screened-in cases in 2019 and 2020 seems to have decreased by about 100. Any comments on what you think is happening there, or what you see as that trend? Obviously, it isn't related just to COVID because it started in 2019.
Yeah, I don't have an answer for that. Sorry.
Okay.
And Dr. McGinnis,
yeah.
I'm sorry, I'll have to look into that too as to why that is.
Thank you, I would appreciate that.
Any other questions? All right. The next area was Comprehensive Community Services, or CCS. In May of last year, in May of 2020, Becky Kerr was hired as the administrator for this division, which was just created, actually, in 2020. So CCS became its own division. Becky Kerr was hired as the administrator. And CCS, very generally, is a set of services that provides alternative care, alternative interventions for people diagnosed with mental health and or addiction disorders. And some of those alternative kinds of interventions, I don't want to label the program as this necessarily, but things like equine therapy and yoga, motivational interviewing, and person-centered approaches to working with people. As someone mentioned earlier, maybe it was Shar, addressing people at where they're at in terms of their recovery and helping them to move forward in ways that make sense to them. It's a very flexible, a very, I think, progressive way of addressing addiction and mental health disorders, using the person's own plan as a mechanism for moving forward in recovery. And CCS in 2020 had some struggles with maintaining caseloads. That you can see they kind of dropped off in the later months of the year, but we're starting to see that rebound now in 2021. But Becky, I would just welcome you to make any comments related to CCS that you would like to, that maybe better define your division and what you do there.
I think you did an okay job with that, Bob. Really, it's just what he said. We work with folks from children all the way through adulthood that have mental health or substance use disorders. And we have seen, over last year with the pandemic, we did see a decline in numbers. We certainly have seen those pick up now this year. At the end of April, I think we were at 114 people that are actually enrolled, but we have 28 referrals that are out there. So, and what I mean by that is they're in the process of getting enrolled. So in order for people to be in our program, they have to have Medicaid. So in some cases, it's trying to help them get that Medicaid so they can get on the program. In other cases, it's making sure that they have the diagnoses needed to enroll in the program. So there's some certain requirements that have to be met to enroll, and that sometimes takes time to get established and collected. So, yeah, I think, we're certainly working to get our name more out in the community, and I think that's helping. One of the things from last year that really, I think, had an impact is the majority of the people that we're working with right now in CCS are children with severe emotional disturbance. And with the schools not starting last year, that really had an impact on the enrollments. And as we've seen school come back into session, we've seen those numbers going up again. So, and we have people who will enroll and discharge in any given month, and you'll see that in that graph there. So our numbers are constantly kind of going up and down based on, graduation or enrollment. So.
And your division was impacted just as other behavioral health and other provider or other divisions were impacted by the lack of capacity in certain provider settings or their inability to take new admissions and that sort of thing.
And we also found, where some, doing yoga or boxing via video doesn't work as well as doing it in person. So we certainly saw where recipients weren't wanting to do those things, and providers too, having to figure out, how do I do something totally different than what I used to do? So certainly had impact.
Thank you. Any questions for Becky? Next is the Economic Support Division. Rhonda Brown is the division administrator, and the Economic Support team is a part of a 10-county consortium called the Great Rivers Consortium Income Maintenance Consortium. There's a number of programs listed on page 25 and 26, Food Share, Badger Care Plus, Medicaid, long-term care, caretaker supplement, and the heating assistance, Wisconsin Shares Child Care Subsidy. One of the things I wanted to point out, Rhonda, then I'll turn it over to you, but one of the things I wanted to point out was the comment on page 27 under the bar graph there for income maintenance recipients, which shows the that approximately 12% of St. Croix County residents were served by our economic support team, and that the economic advantage or the support that these individuals received really translates to support for local businesses, support for hospitals, support for healthcare, and many of the other businesses and other areas of our community that benefit from the economic support that the individuals receive. But Rhonda, you can explain that a little further if you want, or add any comments that you have.
I think that explains it pretty well. Yeah. Obviously, the expenditures hit our communities in relationship to food and nutrition and healthcare, as you said. In terms of our overall data, I mean, the pandemic had some clear impacts there. I guess an easiest way to say it might be for the steady growth in cases and recipient numbers that you see there, that is also denoted in the same page that Bob referenced. Is because there were some temporary policies that really prevented us from taking negative action on cases. In other words, individuals maintained eligibility in some instances in which they may not have based on regular circumstances, which also produced less need for applications, less need for renewals, and actually less calls. So that explains why you see numbers going up in cases of recipients, but the numbers that are indicative of serving them went down, if that makes sense. So, and then in addition to that, I would say the other big change would be the food share program, in the sense that there, again, temporary policy change to postpone the renewals, as well as postpone 6-month report forms, again, to maintain eligibility for individuals during the pandemic. as well as a couple of programs. There was pandemic EBT, so pandemic electronic benefit transfer benefits that were additional benefits, in addition to emergency food share allotments that were additional benefits. So again, you can kind of see that in the data, which in years from now, I'll have to remember exactly what year was impacted and why that was. Not that I'll forget the pandemic anytime soon, but yeah, so that kind of explains our data. Any questions from anyone? Pretty straightforward.
Yeah, I had a quick question about childcare benefits. Did you see a change in the request or need for childcare benefits as a result of changes in how people are working, or maybe not working as a result of COVID pandemic situation?
Yeah, well, maybe not as much as other programs. And again, there were some temporary policies with the childcare programs as well that were both implemented for consumers, but also for childcare providers as well, to try to help businesses stay in business, maintain their businesses throughout the pandemic, obviously trying to maintain quality childcare options for when the pandemic impacts lightened and people were going back to work and things like that. So, but in terms of the program, I'm trying to, grab the data here. I don't have the comparison. In terms of overall numbers, though, it remained relatively constant, I would say. And childcare, again, is one of those programs that, with poverty, food share and healthcare increase, right? But it's the opposite for childcare, meaning that it's a program to help individuals go to work or go to school and work. So when the economy is doing better, childcare is actually higher, if that makes sense. So, but overall, I think childcare was fairly consistent in terms of data, even though we were definitely dealing with temporary policy changes. Did that answer your question? If you wanted something specific in terms of data, I could definitely get that for you.
No, that you answered my question just fine. Thank you.
Oh, okay. Yeah, you're welcome. Anyone else?
Thank you, Rhonda. I was on mute.
Oh, thank you, Bob.
All right, moving right along then to public health. Obviously, we've all had regular updates from public health on the COVID-19 pandemic over the course of the past year, and certainly in 2020. The pandemic was not, in the public health world, it's not something that's totally unexpected, but you still don't expect it to happen when you're in your career necessarily. Well, this did, and we had to respond, or the Public Health Division had to respond to a novel virus that no one knew much about, that was taking over and was spreading across the globe. So as a local public health department, Kelly Ingen, as our division administrator and health officer, mobilized our relatively small public health team in a way that I think effectively responded to this pandemic, given the science, given the knowledge that we had in any given moment, and responding to it effectively. There were difficult decisions to make. There was lots of changing dynamics to this pandemic. And I have to give credit where it's due to our public health division for tirelessly working to adapt and respond in ways that protected the public's health. That is probably more obvious to you as a function of public health and some of the other programs and services that they operate, but there are a number of other things that public health does as a level 3 public health department. They're listed on the following pages under public health units. There's the administration and oversight of a public health division. There's community prevention. There's all of the things you see: disease prevention, the community health improvement plan and assessment that takes place in collaboration with Pierce County and Healthier Together. infant safety classes, environmental health, nursing, nutrition, and I won't go through them all, but they are listed here and I think warrant some review because that department does a lot more than just responding to communicable disease outbreaks, although that's been certainly a major part of what they've done in 2020. Kelly, I know we've included some data here in summary from 2020 on the pandemic for you to look at. I'm looking through real quick here. I think that summary data is also available for caseloads related to WIC, Women, Infant, and Children Services. And Kelly, is there something in particular, Kelly, you would like to mention in addition to the comments I made or any of the information that's in here?
No, just recognizing, I think the work, there were programs, to be a level 3 health department, we have to run at least 14 different programs. Obviously, communicable disease was the major focus through the entire year of 2020 and has been nearly the entire focus of thus far in 2021. I think a lot of some of our programs were really able to maintain their functionality and the services that they provide to consumers. Those are our nutrition programs and our environmental health program. And those staff too were pulled into the COVID response, yet maintained program work that had to be done and was done anyway. So I think back over the year and just am so grateful to have the staff we had here and the longevity of the staff we had here. We are facing, we are facing almost over half of our public health nursing staff will turn over as of June 18th. We had one retirement last year. We had a retirement in May, and we'll have our final public health nurse retirement in June. That is going to be quite a challenge facing 2021, and I think the board needs to be aware of not only getting through the rest of 2021 and the pandemic, but also that's a huge workforce issue for us when you only regularly have 15 employees and 3 of them all in one subdivision, if you will, of public health nursing. So we're looking at how we are going to adapt and move and focus on that. But I think in closing, just a big thank you to everybody and our volunteers included. And it wouldn't be good of me to not call out one of our special board members who also came back to work and really helped us this last spring with mobilizing our volunteer pool, which were utilized big time in vaccination clinics. So thanks, Deb Lindeman, for your continued love for public health and willingness to keep on with us.
We had some great volunteers, luckily.
Go ahead. Did you have a question?
Oh, I'm sorry. The other thing I would mention is we did get some funding from the Department of Health, State Department of Health, for that we were able to use towards limited term employees in some capacity to help us with contact tracing and testing, contact tracing and disease investigation in 2020. That was, I think, needed to help support the existing public health staff, the permanent staff. Thank you, Kelly. Thank you, Public Health, and thank you, Board, for supporting them throughout 2020. And Ken, our County Administrator. Moving on, the last area that I wanted to cover was the healthcare campus. There was obviously a concern early on in the pandemic in 2020 for older residents and protecting them from this virus. We have the healthcare center staff to thank, Sandy and her staff to thank for, I think, taking the necessary kinds of precautions to really ensure that residents and staff were safe during this very trying time in 2020 for nursing homes and for long-term care facilities. There were some impacts from COVID-19 in terms of the ability to offer certain services like dementia care for as a part of the Kitty Roads program. We weren't able to open that in 2020 due to pandemic precautions and to ensure that the residents of the healthcare center stayed safe from the pandemic. There was reduction in some census numbers, again, pandemic related, but Sandy and her staff were able to provide more one-to-one care for those residents to ensure that they had social support and were emotionally taken care of as well as physically taken care of. It cost a little more to have that individualized care, but it was necessary to ensure the well-being of the residents in your facility. 2020 was very challenging for you. Sandy, if you have comments that you'd like to make with respect to any of the data with regarding census or anything else that you would like to point out.
Our census was down. Our average census was 37 for 2020. We did continue to do a lot of admitting of residents throughout the year, but not as many rehab patients because the general surgeries were not happening, the elective surgeries were not happening. Some of that is picking up, some now. We did in 2020 lose some of our very long-term residents, which is the base of your census, and that made a difference in our base census. So the other thing that's of note is that our outpatient, we were able to provide some outpatient to rehab to our residents in Orchard View Terrace, but we're not able to serve our community like we had been. So we saw a significant decline in the amount of outpatient clients served for 2020 over 2019. We were actually ramping up with our pool therapy. We're just now starting back with our outpatient therapy for some of our clients that have been rehabbed home. We're bringing them in we have a separate door to our pool. So they're coming in there, and then in the afternoons, we're having them come in separately when our residents are not in our therapy department. So there's been, like Kelly said, it's been interesting. It's in my years, I've never been through a year like I've been through, and I've been through many years. However, the amount of changes in regulations and guidance was almost overwhelming to keep up with, and that continues. I mean, you don't want to miss a change. So that public health has been great to help us out with that. I think Kelly and her department, and Heather has kind of been our contact for long-term care and holding meetings weekly with the nursing homes and nursing facilities in the area. Such a great team to work with and help us keep everything sorted out, because it is a lot to keep track of. And finally, I just want to say that the awesome team that I work with, the staff and the nursing assistants never blinked, and the love and care that they have for our residents, and they missed our families too. So when the doors opened the last couple of months to let in some of our families, our staff just because they missed that was part of their family too. So we continue to have to be fully masked and wear goggles or face shields when we're in our facility. However, our residents now can I'm happy to say they now can go to activities. They can eat with their friends because of our vaccination status. We have a very high vaccination status. So that's been wonderful to see. So faith in the vaccine. So I don't have anything else unless you guys have some questions.
Any questions for Sandy? Bob, you have
Sure,
any
I'll
additional
say-
comments?
Dr. McGinnis.
Dr. McGinnis.
Yeah, go ahead, Dr. McGinnis.
Yeah, just it's not really a question, Sandy. It's just a comment and a compliment. You know, nursing homes are one of the most vulnerable places, and a significant number of deaths occurred in nursing homes that didn't adequately either prepare or respond or react. And the fact that the numbers of deaths in our nursing homes were so low in St. Croix County, and specifically in your facility, is really a credit to you and your staff, and to the vigilance and the care that you took care of those folks that have been entrusted to your care. So thank you very much.
Thank you for that.
No, that's the concludes the report. I just want to thank all the division administrators for being in attendance tonight to answer questions, and Dr. McGinnis will get you an answer to your question earlier. Thank you.
And thank you, Bob. And again, this board also would like to thank all the administrators for taking your time to be with us tonight. And we greatly appreciate all the good work that you're doing as well. Keep it up, and we thank each and every one of you for all the good things you're doing. So, with that, we'll move on to requests for future agenda items. Anyone have anything that they would like to request? Greg.
Are we going to have a follow-up on housing and homelessness?
Mr. Chairman. Thank you. That report is being compiled, and I'm hoping that it will be presented in July. Currently, the Wisconsin Balance of State is moving to a new data system, and so we are literally moving hundreds of thousands of files. So compiling the complete data is not available at this time. Also, the census will be released allegedly April 30th. Those numbers are used as the documenting point when we're looking at rental properties in doing an analysis. One of the other requests had been, has there been a housing survey? Housing surveys are generally done by communities, townships, villages, or municipalities. The average cost, $65,000 to $250,000, and it is a lengthy process. So having a housing survey done is not going to happen. However, an analysis of housing within St. Croix County is something that we can achieve. So hopefully that will be presented at our July meeting.
Could we have a discussion of what we're going to do with the federal funding from to the county and supplementing low-cost housing? I don't want to discuss it now. I just want to know if we
Yeah, that discussion probably wouldn't happen at this committee level. It would happen at a full county board committee as a whole level. So the discussion will happen, but probably just not at this level.
Okay.
Anyone else have any requests? All right, seeking none, announcements. Bob.
Thank you, Mr. Chair. I just wanted to reiterate that Michelle Lesha has accepted the position of Interim Children's Services Division Administrator, effective today. We are posting for that permanent position currently, so that job is advertised. Char Lopez has assumed the duties of Operations Manager, effective today as well. That is also the result of Julie Kring's resigning her position and leaving yesterday. So congratulations to both of you, and thank you. And Ellie Clausen, as the third person I just wanted to again mention, has accepted the position of epidemiologist for our public health department, and that's a new position that hasn't existed previously. I think it will be of tremendous benefit to all of HHS and certainly the public health department. So congratulations, Ellie. Just one other quick thing, actually around funding is our behavioral health division received a $75,000 grant. It's called a State Opioid Response Grant. The effort here was to apply for some money to pay for uninsured individuals who might benefit from medication-assisted treatment options related to opioid use and to treat methamphetamine addiction, primarily through our matrix model that we currently offer. Kristen Depre wrote the proposal, and it was awarded to us this week. The award was given this week. Our target population will consist of populations like people leaving jail and potentially those in homeless shelters or in situations of homelessness. I'll give you updates on that as we move forward. We were just awarded the funds. The other quick mention was that substance use disorder and mental health block grant dollars, we're told, are going to be increased. There'll be an increase in funding for those. We don't know what that is yet. The state representative was quoted as saying it will be a lot. So it's going to be a lot, I guess, whatever that might be. Well, I quoted him on that. I won't give his name. And then lastly, I would just say along the lines of addiction treatment and the impact that it has on our various divisions, children's services, behavioral health, CCS, et cetera, is that we have started a provider meeting once a month where we've gathered together area providers of addiction treatment, hospital representatives, public health, other areas of healthcare and mental health, in an effort to design a continuity of care, a continuum of care within our county that better communicates and better coordinates the way we approach addiction treatment. And a part of that will include looking at withdrawal management services through partnerships with community providers. And that would be like what you would typically think of as a detox center. We're just in the beginning stages of that, but DHS seems interested in hearing a proposal around how that could be developed in our communities. That would be a resource for people who are suffering from acute intoxication and or withdrawal. So there's potential there for something. We're just exploring it. I just wanted to make you aware that we're talking with community partners on ways in which something like that could be realized. I think that was all I had. I don't really have an update on the legislative session. Of course, our hope is that Medicaid expansion and many of the things in the governor's budget are somehow approved. But I don't have, I'm sorry, I don't have any further updates on that, and the status of those bills or what the likelihood is of any of that actually happening. But we certainly support the governor's budget and the things in it, as well as the expansion of emergency beds in Eau Claire as a regional option for law enforcement and us.
Brad, you had an announcement?
Sure, I've got a couple. We did a collaboration with Public Health and the Adrc. We received a grant, and I just want to read it for the public comment part. COVID-19 vaccine for those who have had difficulty leaving their own home. Are you 18 with a disability or over the age of 60? Have you received a COVID-19 vaccination yet? Would you like to receive a COVID-19 vaccination but have difficulty getting to a vaccination clinic? Please contact the Aging Disability Resource Center of St. Croix County. We can help you get vaccinated. It's on our Facebook page, and you can call our local number, which is 715-381-4363 for more information. So we're trying to get people that want to be vaccinated, especially the homebound. This was delivered to every homebound participant, and anybody in the community that needs help, we're willing to transport them or get the vaccination to them. So, and the other thing I wanted to mention is Music by Heart. Join us for a community sing-along Sunday, June 13th at 1 p.m. at the Hudson Bandshell in Lakefront Park. Our goal is to increase awareness of dementia by involving faith communities and maintaining and supporting members throughout their lifetime. We promote involvement in musical activities that are familiar, fun, and family-orientated. This day includes dementia-friendly services hosted by churches throughout St. Croix and Pierce County, and that's provided by our new dementia specialist. So I encourage anyone for going for Music of the Heart sing-along on the 13th. That's my 2 announcements. Thank you.
Anyone else? Okay, I'll let this board know that this will be our last Zoom meeting. Starting next month, we'll all be back here in person. So we'll need to be planning on that one. I think admin talked about it, if I remember right, last night, and made the announcement. Transportation has made the announcement. CJCC has made their announcement as well. So starting next month, we'll all be back in person. So I'll just be sure we're planning for that one. With that, our next meeting will be June 16th, 5 o'clock, right back here. And with that, thank you everyone for your time tonight.
Here, Osmus?
Yes, ma'am.
I'm so sorry, I couldn't get off mute fast enough. I do have a quick update. Our annual Wisconsin Public Health Association and Wisconsin Local Health Department Boards Association, we have our annual conference next week. It is a virtual conference, and I will give that information to Colleen. I know some board members have been interested in getting involved in what we call WALDAB or WPHA. So I'll make sure you guys all have that announcement. It is not free, but you do get reduced rates because we are a member organization, and everyone on this board is a member of that association. So, sorry.
No, that's okay, Kelly. Ken and Adam, I forgot to look at you guys. Did you have anything at all? Ken's still smiling, so we're doing something right, folks. And with that, we're adjourned tonight.